This is a case of a hypermature cataract with a phacolytic glaucoma. As you see here, there is some pseudohypopian material in the anterior chamber, and the case starts with staining of the anterior capsule with vision blue, and viscoelastic is used to fill the anterior chamber here. A two-step corneal incision is done temporally, and over here I've used a 27 gauge needle to first puncture the capsule and aspirate all the cortical material. As you can see, this is hypermature cataract. There's significant mobility of the nucleus now. There is no actual zonulisis, but the lens nucleus is quite small in compared to the capsular bag and is mobile within the capsular bag. So the capsular axis is started here and completed if appropriate size. In anticipation of any capsular problems, the anterior capsule should be of the correct size, so indeed you need to do a sulcus intraocular lens with optic capture perhaps. On completion of the capsular axis, as you can see here, some viscoelastic is injected into the capsular bag and to go around and support the nucleus as much as possible. As you can see here, there's quite a lot of movement of the nucleus. Now traditionally this could be a challenge to chop, so in this case I've decided to use the endocapsular lens fragmenter, which is using a nitinol loop which is extended and goes up to the equator of the lens, using a second instrument here to stabilize the nucleus as the nitinol loop is deployed fully to extend around the equator of the lens and then brought into the center and retracted to segment the lens into two. The nucleus is rotated and the nitinol loop deployed again to further segment the lens into 4 quadrants. Phacoemulsification is carried out in a normal manner. In the usual hypermature cataract with a mobile nucleus, chopping can be quite difficult, but with the use of the endocapsular lens fragmenter, the nucleus has been divided quite nicely into quadrants, and using the Centurion balance tip here, it can be efficiently emulsified. Care has to be taken, however, that the posterior capsule does not come towards the phaco tip. Some of these cases there may be associated floppiness of the capsule, and second instrument is usually placed behind the phaco probe or to manipulate the nucleus such that the capsular bag is kept from coming towards the phaco tip. Emulsification here is going nicely. It's important not to come too far anterior, as when you're phacoing such dense nuclei, phaco energy could have some effect on the endothelium. Phacoemulsification at the pupillary plane is ideal. As you see here, I've removed half of the nucleus, and the remaining 2 quadrants I've switched to a spatulated blunt instrument to manipulate the nucleus, but at the same time, as mentioned earlier, to keep the posterior capsule away from the phaco tip, and I find that using a blunt instrument is less likely to cause damage to the PC. I have designed my own instrument whereby it is a double-ended instrument with a chopper at one end and this blunt tip instrument at the other, so I can rotate or flip the instrument from a chopper to this spatula easily without having to get the instruments changed from the scrub nurse. As you see, this is a relatively large piece. I've just flipped the instrument round to the chopper and tried to attempt to break it up a little bit more, and after doing so I can then flip back to use my spatula to protect the posterior capsule. I find that when it is the last piece that's remaining in the capsular bag, it's useful to actually have the blunt instrument to protect the capsule to prevent post-occlusion surge. Now with the modern day machines, this is quite unlikely to happen once you get your settings right, but it's just a force of habit to ensure more safety for the posterior capsule. And now I'm implanting a 3-piece intraocular lens into the bag. The lens is dialed into the bag with the same spatulated instrument. Viscoelastic removal is completed, and I always remove viscoelastic from behind the lens as well. And the case is completed. Thank you very much for your attention.